Hi, I'm Dr. Rajjoub and I'm an oculoplastic surgeon. So I'm going to go through a case with you of a patient. She had presented, she was really unhappy with her lower eyelid bags, also felt like her upper eyelids were very heavy. She was concerned she didn't really want to look very different than herself. She wanted to have some natural results, but she wanted to feel a little bit better about herself. So here's our before picture of her. And we can see that basically she's got a lot of upper eyelid dermatochalasis, a lot of extra skin hanging on those eyelashes. She also has very prominent lower eyelid fatty bulges. And so what we planned to do for her was conservative upper eyelid blepharoplasty and a lower eyelid blepharoplasty as well. So here's our after photo. What you can see here is that, it's a very natural kind of contour of the upper eyelids, just sculpted off a lot of the extra skin, but still keeping her looking like herself. We wanted to make sure that she wasn't overdone. And then on the lower eyelids, we did a transconjunctival incision. So that means that we're basically going on the inside of the eyelid and we're debulking those fatty pockets. We want to be sure here not to over hollow her. We don't want her eyes to look sunken at all. And then after we take out that extra fat, the eyelids can be very loose. So we wanted to do a canthopexy as well. So we want to make sure that the eyelid is tight on the eye and doesn't fall down after we debulk that fat. So in the outer corner, we tighten that eyelid and we're able to get to that actually from the upper eyelid blepharoplasty incision. So she didn't require any extra incisions on the outer corners of the eyelid. So that was able to remain scarless. Then, as you can imagine, when those fat pockets are kind of big and bulging, it stretches out the skin. So there's different ways to tighten that skin. For her, we decided to take a little pinch of skin and remove that. And so the incision is actually right underneath the lashes. So it's pretty well hidden. So we can still see a little bit of pinkness in the photo. She's only a few weeks after surgery, but we can see that that incision is barely visible. We want to be very careful with how much skin we're removing. The worst thing we can do for the patient is take too much skin, and we don't want their eyelid to retract or pull down or to turn out. We can't give that precious skin back, so we want to be very cautious. This patient is only a few weeks out of surgery. There is some difference in lighting from a different room that the photos were taken before and after, but otherwise both she and myself are very happy with the natural results.